And then there is a review of the work done in the last 2-3 months by Dr. Amresh Patil. So you'll get to see what happened in the last few sessions as well. Then there will be a brief talk by the expert committee convener, Dr. Ashok Rai, who has, will tell us how they have planned this antimicrobial resistance campaign. Then there will be your inauguration by Dr. Kishore Bendur sir, who's like our brother senior gentleman here. Dr. Bendur sir, hello, Kariye. Kishore sir.
It will be, I'll be introducing sir, isn't it?
He will introduce you, Jamal Saab, and then after that will be called upon to speak. The only other thing is that we'll ask you to kind of unveil online
Samir, you are muted.
Yeah. Hello?
Yeah, now you are.
Now it's okay.
So then, sir, when you speak, you will also have to say that I declare that the social media flip book is inaugurated, and that time our backend team will play it on the screen for everybody to see. And then you can your address, of course.
Sorry, again, I couldn't hear you.
Sir, I'll send you a file by WhatsApp, sir. The entire itinerary is on that. Abhi aapko main WhatsApp
Voice is breaking, Samir.
Samir, I think there is some network issue.
Can you hear me now, sir?
Yeah, now you are clear.
We are not seeing the video.
I am sending it to you.
Your video also is breaking, both audio and video. Basuraj,
okay, is this better now? Is this better?
Yeah, good afternoon, sir. Good afternoon.
Yeah, Dr. Jamal sir, is this better? Can you hear me now?
Yes, I can hear you now, but I lost your connection in between when you were saying that I was supposed to do.
Yeah, from there you can start, Samir.
Yeah.
Once
So,
Kishore
sir,
sir
when we call you
introduction,
to speak,
Kishore sir introduction from there.
yeah. So introduced by Dr. Kishore sir, who's our senior pediatrician, who's here on the group now. He will introduce you and then call upon you to deliver your address. And during your address or after that, you can say that I declare the flip book to be released.
Okay. The Facebook to be released.
Is that okay, sir?
Yeah.
Flip book. FLIP, flip book.
Flip book. Okay, fine.
Okay. So it's a creative image. It's a different kind of thing. Usually we make a video. This time it is a bit like a comic book. We try to experiment with the theme so that we got some feedback that now we want something different than a video. So it's like those,
the general discussion is for the sake of the common man, not the medical fraternity.
Yes, community, sir.
ठीक है. Okay. I think we are, we still got 4 minutes to go. Excellent.
Yeah. So, sir, yeah, you can see there's some picture on the screen, sir.
Fantastic. Yes. Pretty picture.
Yeah. So you can just say, I declare that this thing to be released and we will release that. That will play it backhand.
Excellent.
Shruti, are you there? Shruti, ma'am?
Yeah, she's there.
I'm here.
Shruti, ma'am, there's some network again, I think, at my side as well.
I will play it. No problem, sir. I'm in a good network place.
Correct. So, Basuraj sir, this time we have experimented with a new method.
Yeah.
Yeah, it is still to be perfected before we release it on media because it has a completely new idea and it requires a lot. I mean, Shruti has been phenomenal. Day and night they have worked to do that. But even then, it will require a bit of fine tuning. But today we are good to at least share the idea with everybody.
Yeah, that's a good thing.
Thank you, sir. Thank you for your encouragement.
I said this activity is every month.
Yes, sir. Almost twice a month, sir. Twice a month.
Oh, very good.
So initially we started with an Anemia Mukt Bharat. That was then a program which has been launched by none other than our Niti Aayog chairman, Dr. Vinod K. Pal. He happens to be the pediatrician, sir.
Right.
After that, we had an autism regarding creating awareness regarding autism. Obesity was another issue. We took it.
And you keep a record of this so anybody
Yes,
can
yes,
go
yes,
to
sir.
the archive and see the topic that has already been discussed.
Yes, sir. Yes, sir. Yes, sir.
Good.
And we will be uploading it in IAP website also, our official
Fantastic.
website.
Sir,
And also we will be,
this is freely accessible to the public in all social platforms of the IAP official pages, including Facebook, Twitter, YouTube, WhatsApp. So it is free to think, and IAP doesn't hold any copyright on this. But then we are disseminating these very simple messages regarding these very important topics to the lay public, so that we dispel a lot of myths that are going around in community regarding these problems in children. And we intend to bring
Excellent.
out many more topics like this, sir.
Right. So we are at 2:30. So
yeah, Samir, if the
Sir,
Shruti is
can we
ready.
start? Yes, sir, yes.
Can we go live?
Yeah.
Right.
Live.
Yes, ma'am.
Please proceed, Doctor.
You are in live, ma'am.
President, sir, with your permission, can we
Yeah, please.
Namaskar, Pranam. Good afternoon, respected President of the IAP, National President Dr. G.V. Basavaraj, sir, President-elect Dr. Vasant Khalatkar, sir, immediate past President Dr. Upendra Kinjavdekar, sir, our chief guest for today, a very senior pediatrician, President of the Pakistan Pediatric Association and President of South Asia Pediatric Association, Professor Dr. Jamal Raza, sir, our guest of honor, Dr. Baldev, our very own Dr. Baldev Prajapati, sir, one of the most senior erudite professors of pediatrics in India. Also, our respected Honorary Secretary General, Dr. Professor Yogesh Bhai Parikh, our National Treasurer, Dr. Atanu Badaraji, all our expert committee members headed by Dr. Ashok Rai, sir, our scientific committee members headed by Dr. Geeta Patil, as well as the other committee chiefs, Dr. Bendur sir, Dr. Shantaraj sir, and our dear Dr. Amresh Patil sir, all the respected members of the scientific committee, the media committee, the other guest of honor today, all the other guests who have joined us today, and all the vice presidents who have been very, very important in taking the message of Indian Academy of Pediatrics to each and every corner of India. Also, we are joined by our beloved past president, Dr. Pramod Jog sir, and all the respected dignitaries of the Indian Academy of Pediatrics who have joined us today. A warm welcome to you as we discuss an extremely burning topic which has the potential to impact the future of not just all of us, but our children and indeed the future of the world in the days to come. And that is the misuse of antibiotics, something which came up as the greatest discovery of mankind that was supposed to save mankind, unfortunately has not been used by mankind correctly and has now become something that is more likely to create harm than good. And how something which is very useful has now turned out to be something that could potentially be dangerous is what our experts are going to convey to everybody today. I would now very happily welcome our National President, Dr. Basavaraj sir, for his address and to help us understand the entire concept of IAP ki baat community ke saath and the topic about antibiotics and antimicrobial resistance. Ladies and gentlemen, we present our National President, Dr. Basavaraj sir.
Thank you very much, Dr. Samir ji, for giving a preamble to the whole program, and respected our chief guest of today, who is none other than our SAPA president and Pakistan president, Dr. Syed Jamal Raja sir. So we know him very for doing an excellent work across the globe, not only in Pakistan, across the globe. So welcome you, sir. And of course, this is joined by our SAPA secretary, Dr. Bakul Jayant Parikh, and Dr. Digant Shastri sir, our past president of Indian Academy of Pediatrics, Dr. Pramod Jog, respected Dr. R.K. sir, our past president, and many of the stalwarts who has been joined. IAP के बाद community के साथ, this is one of the flagship program of Indian Academy of Pediatrics, which has been launched in the year 2024. It is not the this one, it is a program of Indian Academy of Pediatrics with the great support from our President-elect Dr. Vasant Kalatkar, immediate past President Dr. Upender ji, and our dynamic secretary Professor Yogesh Parikh, who has been working day and night to take all the IAP program to the nook and corner of the country, and ably supported by our national treasurer Dr. Athanu Badra, and of course the team of our IAP के बाद community के साथ, which has been led by Dr. Samir Dalwai, our national coordinator for the media, and Dr. Geeta Patil for the scientific committee, Dr. Shantraj for mentoring, monitoring the things, Dr. Kishore Baindur, Dr. Amresh Patil, and many of them are being involved in executing this, and which has been well supported by our vice presidents. They are working day and night, Professor Singaruvelu, Dr. Satish Sharma ji, Dr. Atul Kulkarni, Dr. Santanu Dev, Dr. Ajay Srivatsav, and also our Joint Secretary Admin, Dr. Paramanand Anandkar and Ruchira Gupta, and all the seniors. This is one of the burning problem of the Indian Academy of the children across the globe, not only in India, across the globe, antimicrobial misuse, abuse, and this is been overuse, all these things which has been occurring across the world. And Indian Academy of Pediatrics taken this issue in a manner to spread and create an awareness among the community members. And basically what Indian Academy of Pediatrics does twice a month is to take some of the issues which has been happening across the India and also globe, take that into the consideration and create in a scientific material and spread this material to the members of not only among the Indian Academy of Pediatrics, to the publics. That's mainly which is reaching to the public, where this is going to be shared by all the members of Indian Academy of Pediatrics to their parents and the children's, and also through the Twitter, Facebook, social media, and also the print media and television. That's how the authentic, relevant, and authentic information which is going to be shared, so that the all the community can be updated about this. So when it comes to the antimicrobial resistance, where the 5 actionable points which has been declared by our scientific committee, one is to create an antibiotic use awareness where the misuse, abuse, and overuse which is taking place, where we need to create awareness by all the 374 branches of our districts, where the executive board member as well as the spokespersons which has been appointed by the Indian Academy of Pediatrics, they will be doing it, creating awareness. Second is we need to create a benefits and the risk of antimicrobial usage and awareness for the general public through all forms of media. And the commonest misuse of an antibiotic is in the cough and cold. This is where doesn't require an antibiotic. That's what which needs to be correct usage of a drug. That's another thing which is going to be, and demystifying how the antimicrobial resistance is going to be developed, and also the prevention of infection prevention strategies which needs to be taught to the not only the healthcare professionals and also to others, and enabling an antibiotic stewardship. These are some of the 5 actionable points which is going to be shared with all the 374 branches and also the 80 executive board member and all the other spokespersons, so that things can be taken to the community. And I am very thankful to the scientific committee, especially antimicrobial resistance, led by Dr. Ashok Rai, who has been our past ID chairperson, who has been very instrumental, along with Dr. Rangnath Darur and many of the people who have been involved in this. So best wishes for this program. Looking forward for involvement of all the members in this actively, so that the most important antimicrobial resistance can be prevented. Because antimicrobial resistance is a natural phenomenon. As a healthcare professional, we need to prolong it further. That's what we are looking into this. So over to you, Dr. Samirji.
Thank you very much, respected Dr. Basavaraj sir, President of the Indian Academy of Pediatrics, for such a lovely preamble and for this explanation of how the Indian Academy of Pediatrics, after 60 years of service, now also aims to connect directly to the community, and we have the medium of social media as well as our spokespersons, and that is how the IAP Ki Baat Community Ke Saath came into practice. The next step is to have a joint press release by the President Sir and President-elect Sir Dr. Vasant Khaladkar in the presence of all the distinguished members of the Academy, and especially today our chief guest, as well as all the other guests. And I'm very privileged to say and welcome our past presidents and our beloved Dr. Agarwal sir, Dr. Digan Shah sir, Dr. Bakul Parekh sir, as well as Dr. Pramod Jog sir. So we are very, very grateful for your kind presence. Thank you for being here today. And now we are joined by Dr. Vasant Khaladkar from overseas, and we request the President sir and President-elect sir to jointly declare the press release, and we request the host to share the press release once the presidents give the suggestion. Dr. Vasant.
Yeah, we declare that the press release has been released, and I request all the national office bearers, both EB members and OB members, and the state president secretary, district president secretaries, and official spokespersons of IAP to use this material to create awareness among all the common members of the India and abroad. Over to Vasant. Vasant, are you there?
Doctor, I think he just left.
Yeah, some network issue.
Yeah, no, some network issue. Yes.
He's in Germany. Samir ji?
Yeah, unfortunately, there is a network issue, so I'm sorry for the lag. Thank you for the press release. This will be disseminated all over the country to the print as well as the electronic media. And now it is my pleasant duty has joined us, and I hope the network will be good enough for us to invite our President-elect sir, Dr. Vasant Khaladkar. Dr. Vasant sir, can you hear us? I just saw him a moment ago.
Yes, he was here, but he's not there now, Doctor.
Yeah, Upender ji is there. You can.
While we wait to reconnect with Dr. Vasant Khaladkar, I now have the proud privilege to invite our immediate past president, Dr. Upendra King-Zavdekar sir, to please address the gathering. Dr. Upendra King-Zavdekar.
Yeah, thank you so much, Dr. Samir Dalbai. Respected President of Indian Academy of Pediatrics, Dr. G.V. Basavaraj, President-elect Dr. Vasant Khaladkar, who has joined in from Germany. And of course, my very dear close friend, Dr. Jamal Raza, Director, National Institute of Child Health, Pakistan, as well as teacher of teachers, Dr. Baldev Prajapati, the chief guest and guest of honors for this program, respectively, Dr. Geeta Patil Madam, Dr. Shantaraj, Dr. Samir, and all those who are involved in the IAP Ki Baat Community Ke Saath program, Dr. Kishore Bendur. For the want of time, I won't take name of each and every individual who's been working over the last 13 episodes to make this program a great success. And of course, all dear past presidents of Indian Academy of Pediatrics, respected vice presidents, all the EB colleagues and senior members of IAP who have been working over the last 60 years to make IAP really a body to be recognized with. And today's important episode is mainly because of antibiotic awareness. Remember, this is a community awareness program, and we need to go a step beyond our consulting room. All of us understand the judicious and rational use of antibiotic is essential and integral part of our clinical practice. We have to ensure that the utility and therapeutic efficacy of the antibiotic should be increased, and we have to minimize the emergence of resistant pathogens. I think all the guidelines are in place, starting from rational treatment of respiratory tract infection, the gastrointestinal tract infections, CNS infections. But today, I would just like to summarize it in 4 points. And I feel that we need to percolate this message to our pediatrician colleagues as well as to the masses. And I would sum it up in acronym CARE, C-A-R-E. So 𝐾𝐧𝐿 stands for community acquired infections are still much more common than the nosocomial infections. So baseline antibiotics are still very much useful, friends, rather than the high-end antibiotics. So let's remember that. In your personal practice, is your use of amoxicillin more or co-amoxiclav more? You ask question yourself. Your use of cephalexin, cepatroxyl per skin and soft tissue more, or are you going for a higher in antibiotic? So that's number one. Community infections are much more common. A stands for, again, antibiotics which are to be used are only for bacterial infections and not for viral infections. So am I treating a bacterial infection is to be answered first. And barring few exceptions like influenza, wherein maybe you have to cover it up with antibiotic, I don't think any of the other viral infections deserve antibiotics. So please refrain. If you are talking to patient that this is a viral infections and you are still writing an antibiotics, your hand should tremble. That's number two. Number three, recognizing the local resistance pattern is extremely important. Be in touch with the local microbiologist and then use your antibiotic. MSSA, MRSA, one has to be aware of the pattern. Dr. Jamal Raja sir, we are talking about XDR typhoid. I'm sure you would be discussing a little bit more when you address the gathering, but we are all worried about the pattern in Pakistan when we declared that it could be ceftriaxone resistant typhoid. We can't even think of it if such thing really happens to India also. And the fourth part of this educate. I think time has come. We have to talk to the patients sitting in front of me that why am I not writing an antibiotic? Don't be worried. The patients demanding antibiotics is not at all a valid explanation. So let's educate, empower the patients to understand the difference between a bacterial and viral infections and stop using antibiotics indiscriminately. I'm sure if we take really proper use of this CARE acronym into our practice, our use would be definitely proper, judicious, rational, because rational does not mean reducing the use, but proper use is essential, and not only in OPD, but as well as IPD practice. I'm sure this program is going to go and percolate to all our masses. Thank you, Dr. Basavaraj, Dr. Basan, for initiating this, and thank you all the members for taking it across. Please let it not limit to your OPD practice or indoor practice. Let it go to the masses. Thank you everyone for joining the program. Thank you.
Thank you so much. Thank you so much. And in fact, that is the way we have highlighted today's event as well. The creatives will be designed for the masses. Meanwhile, Dr. Vasant Khaladkar, our President-elect sir, has rejoined us before the network goes weak. I take the privilege of inviting Dr. Vasant from Germany to address all of us.
Yeah. Good evening. Good afternoon, all. Here it's like morning actually. So, hello from Germany. Respected Dr. Basavaraj, President, and all dignitaries, today's chief guest and guest of honor. Really, we are trying hard. I know Indian pediatricians are trying hard to avoid antibiotic, rational use of antibiotic. And that's a chapter is very important role. Their ID chapter and members are playing very important role in antibiotic abuse to avoid. So my request is that it is very important to teach our people, that our member, that is very important. We are having a biggest strength, that is of 46,000 member. If out of this 46,000 member, if this today's message goes percolated and followed by not 25,000 member, it's okay. And that is the thing, because all rest of these Ayush people or your MBBS people, they follow we people. Whatsoever you, whenever there is a call from any medical representative, they say, sir, aapka prescription is very important for us, because your prescription get followed by all the pediatricians. So that's why you first learn yourself and use judiciously antibiotics. That is very important. And so I think today's important message is, this is program for two people, our colleagues, and second is our community. Community, why community? We have to teach the community and our patients, parents, that what is the disadvantage of antibiotic, what is the advantage of antibiotic, why, and they should not force us, and we should not get waived because of as patients say, this sir, please write antibiotic. And important among that, our hygiene. I'm here. I'm saying very less number of patients are here in foreign. Why this? There definitely hand washing and hygiene maintenance. That is a very important part, which is going to play a biggest role to using less avoid antibiotic. So I once again thanks and wishing all the best. My request to all the members, whatsoever information you are getting from Central IP, please follow it and percolate it. Thank you. Thank you.
Thank you, Dr. Vasant, for joining in spite of being abroad and your important messages that we have to spread this message to our pediatricians as well as to the community at large. Thank you very much. I'm now privileged to invite our Honorary Secretary General, Dr. Professor Yogesh Parikh, who has been taking this program all across the country and been working meticulously to see that it is a success. We present you Professor Yogesh Parikh.
So, good afternoon, everyone, respected seniors and dear friends. Thank you, Dr. Samir, for the nice introduction. So, our president, sir, already mentioned about this threat of the critical issue of the global health antibiotic resistance. And we welcome here our chief guest, Professor 𝐔𝐧𝐥𝐤𝐢𝐧𝐠 Raja from the Pakistan, and our beloved teachers of the teacher, Dr. Baldev Prajapati, sir, as a guest of honor. So we know antibiotic resistance occurs while the bacteria evolves and its ability to defeat the drugs resistant to kill them. So this makes infection harder and the disease spread. Then the co-sequence starts. So misuse and overuse of the antibiotics in the mainly in the humans, animals, and the agriculture are primary drivers for this resistance. Recently, I was there in the Delhi to attend the AMR summit by the WHO and the ministry, and the 50 associations were invited there, and they all appreciated works done by our past presidents and the IAP since more than decade, and everyone appreciated that taken note of our efforts for this antibiotic resistance. And we made the presentation of the IAP work done in the past, and that was the now other associations are also following that. So we know all these antibiotics have consequences are very dire, and that it can be lead to longer hospital stay, morbidity, and the mortality. And to combat this issue, we must take collective action. So this is the IAP की बात community के साथ, and we are addressing with this antibiotic resistance 13th episodes under our IAP की बात community के साथ program, the use antibiotics judiciously and prevent antimicrobial resistance. For this, as a advocates of the children and the healthcare professional and the policy maker and this respective members of the community, we all have to have a pivot role to play in preserving the effectiveness of antibiotics for the future generation. So let us work together to raise awareness. Every year we are celebrating. Now we are creating the awareness to educate community through the parents, teachers, and our IAP members. So let us implement the strategies to combat this antibiotic resistance, and we have a lead role to save this earth and the future generation. Thank you, Samir bhai. Over to you.
Thank you, Yogesh bhai. Thank you so much. And yes, it is our responsibility to save the world from this antibiotic misuse. And it's a very important message. I was to invite our treasurer, Dr. Atanu, but he is busy with the family commitment today, which is not able to make it here. Going ahead, any program, it's easy to launch the program, it's easy to begin with it, but it's very difficult to sustain it, and it's almost very rare that people show accountability for it. But this is the hallmark of this program, that we are showing the accountability by reviewing whatever has been done in the previous 12 episodes or 12 programs that we've had for IAP Ki Baat. And it is our dear friend, Dr. Amrish Patil, who will now tell us about the work that has been done with the past programs. Amrish bhai, can you hear me?
Yeah, sir.
Okay, okay. So, ladies and gentlemen, we present Dr. Amrish Patil to you.
Thank you, Samir sir. Respected President sir, Prasad sir, Vasan sir, Upendra sir, Vice Presidents and Core Committee. It has been a busy month for almost all the pediatricians across the country with the monsoon raining in and a lot of dengue cases and viral cases. And we had launched the dengue in the previous month. So most of the pediatricians were busy practicing indoors and treating the dengue patients. But along with that, there has been community work which has been carried across the India, not only on dengue, but there were vaccines, HPV awareness vaccine which has been done. Wonderful campaigns where mass campaigns done. So I request Dr. Shruti, Ms. Shruti to kindly play the video. Also, there were CPR campaigns which are going on, and there were anemia awareness camps, obesity camps which are going on. So a picture would depict more than 1,000 words. So I request Shruti to kindly play the video so that everyone can go through it. Thank you for playing the video. Humble request to all IAPs across the country and across the world to kindly download these wonderful antimicrobial posters which are being going to be released by IAP and display them in our OPD waiting areas so that the message will be populated to the community. Together we can. Thank you.
Thank you, dear Amrish. And this is how we have been able to explain how we continue with this work. As Dr. Amrish Patil said, all these creatives, all these collaterals, flyers, videos, whatever it is all available on the Indian Academy of Pediatrics website, Instagram, on the Twitter, on the Facebook, and anybody and everybody is more than welcome to download it and share it in your practice in your community. Next part. So thank you so much for that. Now we move on to have the entire science for this is organized by an expert committee which is appointed by the IAP, and the expert committee is convened this time and led by none other than a very senior pediatrician, Dr. Ashok Rai sir, who's the convener of the committee. Just a few days back, I heard him deliver an excellent oration on growth, development and behavior, and at the same time he's such a brilliant expert on this issue as well and working so hard in the community. We request Dr. Ashok Rai sir to please deliver his address.
Thank you, Shamir. And first, respected Dr. G.V. Basavaraj sir, National President, President-elect Dr. Basant Khaladkar, immediate past President Dr. HSC Dr. Yogesh Parekh, and our Chief Guest Dr. Baldev Prajapati sir, Dr. Jamal Raja, our past Presidents Dr. Bakul Parekh, Dr. Digant Sastry, Dr. R.K. Agarwal sir, Dr. Pramod Jo, and Coordination Coordinator Dr. Samir Dalwai, and Dr. Geeta Patil ma'am, Dr. Kishore. Friends, we have prepared this for the public, and we should propagate the messages to the public in the clear voice. Like antibiotics are miracles of medicines, but we must use them responsibly. Its use is not a free ride. It comes with a lot of risk. We have to stress that the fever is not a sign of antibiotic deficiency, and future of antibiotic depends on all of us, even on pediatricians, on doctors, and pharmacists, even on public also. Friends, we have to stress that overuse of antibiotics has increased the number of drug-resistant organisms, and we have to tell the public that do not share antibiotics or take antibiotics prescribed from someone else, and avoid irregular dosing or stopping antibiotics only to prevent resistance. Self-medication is a big problem in our community, but we haven't seen that is a big challenge for India also. So access to antibiotics without prescription, use of pharmacies and informal healthcare providers as a source of healthcare are other factors that increase antibiotic consumption in India. Friends, we have to antimicrobial resistance has been a public health emergency with exponential increase in resistant microbes. So use antibiotic responsibly, and we have to write to the government of India that over the counter sale of antibiotics should be banned at all. And we have also just Dr. Yogesh Parikh has discussed that there was a meeting in the Delhi organized by Indian Medical Association where 50 organizations took part, and this was also a agenda that over-the-counter sales of medications, antibiotics should be discouraged. So thank you very much, Dr. Samir, and for inviting me. Thank you very much.
Thank you so much for your message, and it's so important that we have to get this message out to the community. We are seeing so many lovely messages from our members, especially about the over-the-counter sale of antibiotics by chemists, etc. I think wonderful messages, and I would like to compliment Dr. Basavaraj sir and Dr. Yogesh sir and the entire scientific committee for taking up this topic, which brings me to Dr. Kishore Baindur sir, our dear brother, who is one of the leading senior pediatricians, as well as he has a very important task of looking after the monitoring committee, whether the work of this program is being done correctly. And Dr. Baindur sir, we request you now to come over, say a few words, and also to perform the wonderful task of introducing and welcoming the chief guest for today, Dr. Jamal Raza. So Dr. Baindur sir, it's over to you.
Well, namaskars and good afternoon to all the dignitaries who have assembled here, to the President, Dr. G.V. Basavaraj, President-elect Dr. Kalatkar, a host of past presidents who are so lively and are being with us, our committee members of the IAP की बात community की साथ. As has been told by the President and the President-elect and by the scientific committee head, Dr. Ashok Rai, we are on to a very, very important topic, and that is antibiotic use, abuse, misuse, etc. And the onus of the Indian Academy of Pediatrics through this particular program, that is IAP की बात community की साथ, is to disseminate knowledge in the barest form, that is where a community participant, a parent it could be, or a common man can understand the nuances of what this problem is in their own language. This program, the beauty of this program is specially designed for people to understand nuances of medical science without using big names, jargons, etc. If you have looked at our material in the past, we have had about 12 of these topics that were covered, and today we are into the 13th topic. Each of these topics have been very well received and disseminated by our own pediatricians, the district and the state branches of IAP through the zonal vice presidents who have been so very active in disseminating this program. In the days to come, I am sure this will reach much more people, and we have archived these things into our own official pages of the Indian Academy of Pediatrics. And in fact, it's not only in India, but Southeast Asia, it could be South Asia, or in other parts of the world. We have been receiving some feedback that it is reaching to the masses all over. So with this very brief introduction of this particular popular program, I have been given the onerous responsibility of introducing a giant among pediatricians in this part of the world, I would say, and that is to introduce Dr. Syed Jamal Raza from Pakistan. A giant among pediatricians, I would say, because he is now heading the South Asian Pediatric Association, that is the president of the SAPA. Sir, we welcome you fondly to this program, and I would like to introduce Professor Syed Jamal Raza as a senior pediatrician hailing from our neighboring country of Pakistan. He He is now stationed at Karachi, and he has had his MBBS degree as early as in 1985. And you can understand that in more than about 40 years of his pediatric practice, he has risen to great heights. He's completed his initial training in pediatrics in Karachi, and then has completed his MRCP from London in 1995. His special interest is in pediatric endocrinology, and he's completed his training and degree in pediatric endocrinology in 1996. So currently, he is now the executive director of the Sindh Institute of Child Health, the president of the Pakistan Pediatric Association, a very prestigious post. He is the president of the SAPA, as I told you earlier, South Asian Pediatric Association. He is the president of the Endocrinology and Diabetic Association of Pakistan. Of course, he was the ex-director of the National Institute of Child Health, Karachi, and many more such responsible posts were held by Syed Jamal Raja. Of course, a man of his stature has climbed up the teaching ladder from being a humble house officer to reach this post of being a professor and now being the president of the Pediatric Association of Pakistan. All this probably, I'm sure, all of us know as academicians, cannot be, done without being rich in his academic experience. He has done immense clinical research. He's a very, very prominent participant in workshops, conferences, and webinars for not only Pakistan, but for other countries of Southeast Asia and the world over. He's had scientific presentations at the national and international conferences. In fact, when I got a CV, it is more than about 20 pages. To see through that and get some pearls were really difficult. Such is his big CV. He has been awarded many awards, prominent among them being the Gold Medal Award from the Pakistan Pediatric Association in 2018, and the very prestigious Muhammad Ali Jinnah Gold Medal in 2014. He has innumerable publications in national and international journals. He has authored many a book. He's done research papers in many journals, and he a clinician to the core, working hard for the upliftment of the health of children in Pakistan and now in the South Asian region of the globe. I welcome Professor Syed Jamal Raja onto this important meeting as this chief guest with a very, and I request all those who are here to welcome him with a warm round of applause. Over to you, sir, with this very brief introduction out of the 20 pages of CV that you sent. Thank you very much. It would
we are eagerly waiting for your answer.
Extremely thankful and humbled and somewhat ashamed to have all that long introduction. Thank you very much. I'm really very honored to be invited as a chief guest on this extremely important endeavor of Indian Academy of Pediatrics, where they are extending their hands to join with the community on the topic of using the antimicrobials judiciously and using the antibiotics judiciously. I think the issue cannot be overemphasized, and it is an extremely important issue. I was just going through some of the numbers, and in one of the recent publication from Lancet, it has shown that there are about 7.7 million deaths due to bacterial infection globally, and out of them about 5 million deaths are as a result of pathogens which are resistant to antibiotics. So that shows how important it is for us to address the issue of resistance of antibiotics by the injudicious use of antibiotics. Of course, the organisms are many, and some of you are known to you like E. coli, Acinetobacter, Klebsiella, others. Interestingly, Upendra mentioned the problem of XDR typhoid, and there's been a recent article in today's leading newspaper where they are talking about how this treatable typhoid turned into a super bug. And it has reported there are at least 15,000 cases reported with XDR in Pakistan. And I'm sure there are many more that have not been reported to the press and otherwise. So this is a huge problem in Pakistan where typhoid has become resistant to all the first-line drugs, and the only drugs that can now be used are Meronem and azithromycin. And we are dreading the moment when the resistant would develop to one of these antibiotics, leaving us with a very limited option. So I think what we need to do is to address the issue to two or maybe three specific areas. And I would just suggest, of course, there's something that has already been said also, but I would still like to repeat that what we need for the judicious use of antibiotic is to select the right antibiotics. First of all, that is the first R that we talk about. Then we select it for the right indication, as mentioned by Upendra, that when we are diagnosing viral infection, then there is no need to use the antibiotics. And then the third thing is to use the right dose and the right duration of the antibiotics. Of course, the antibiotics are a wonderful drug, and they are saving many, many lives since they have been introduced to the treatment of for various disorders. So they are, no matter, wonderful drugs, but in order for us to keep benefiting from them, we need to use them judiciously before we run out of our options. And that unfortunately seems to be very much on the card. So even for the general public, I would again, or the community, I would again request that they have to use the right kind of antibiotics for the right indication, and especially with the right dose and duration. As we all know, in India and Pakistan and many other neighboring countries, there are a lot of myths that go around with the use of antibiotics. Ye antibiotic garam hai, this is a heavy antibiotic, we should not use it for our children. And all sorts of people come and give their own advices with their own experiences. And the advices are always free, and people are willing to take that advice, everybody's advice but the doctor's advice. So for the community also, I would like to give them a message that, use the antibiotic, a proper antibiotic in the right dose for the right duration that has been prescribed to you by your physician. Then for the physicians, again, I have already mentioned that they should not use the antibiotic when it is not indicated, and they should not be afraid to tell this to their patient that, look, this fever is viral, this is going to go away in 2-3 days' time. So please don't use antibiotic, or don't change the physician because your fever is not going down in 2 or 3 days. The most fear that a physician has is that when the fever does not settle down in 2 days, the patient is going to change the doctor. So you can tell them beforehand that you don't need to change the doctor. I have seen your child. This child does not need antibiotic right now. But you can come back and see me in 3 days' time if the fever is not gone. Then choose the right antibiotic. I have seen a lot of antibiotics that are popular. Sometime I read a T-shirt. I remember, it was written that cefixime is not an antipyretic. So please don't use cefixime and the other antibiotics as the first-line treatment for treating fever. So use the antibiotic judiciously with the right dose and duration. And for those of you who are working in the hospital setting, that is also a source of antibiotic resistance and producing resistant organism. So infection control is absolutely must, and especially those working in the ICU and the special areas, nosocomial infection is a very notorious thing that can go around in the community and create big problems. So wherever we are working in the hospital, we have to be absolutely sure that we follow the policies of infection control and make sure that we keep the antibiotic usage to the minimum. We use a step-down antibiotic policy also. So if the cultures are negative, we can easily step down the use of our antibiotics and use them as minimum as possible. And then last but not the least, not our domain, but industry and the use of antibiotics on the animal is also a great source of resistance. So of course, we need policies from the government to minimize the use of those antibiotics. And of course, we need the policies from the government, as mentioned, on restricting the over-the-counter use of or the sale of antibiotic and make them, prescription absolutely must for using antibiotics. As I have said, they are one of the best treatment options that are available for the infections. So let's use them judiciously. Let us try to save our children. Let us try to save our community and make these antibiotics available for our children for a very long time. And remember that and the microbial agents or the bacteria has been there for millions of years. So they are very smart. So, let us not think that we can oversmart them by using very heavy dose of antibiotics or the third generation antibiotic or the fourth generation antibiotic. So let us use them very judiciously and let us keep our children healthy. Thank you very much for giving me this opportunity. And I would also like to take this opportunity for making the flip book open. And I declare the flip book open, and I hope that this will be used for the benefit of children in general. Thank you very much.
Thank you so much, Professor Syed Jamal Raja sir, for your wonderful inspirational address and also the piece of advice and wisdom. Thank you so much, Raja sir. Over to you, Samir.
Thank you so much, sir. आपने शेर नहीं सुनाया मगर खैर अगली बार. But thank you so much. And sir, I just declared the flick book to be open while I request Shruti to share that. Let us say that we got a lot of feedback from the community about what the creatives we are doing. Many people have appreciated the viewership of Instagram page, the Facebook page, the Twitter page has gone up to millions. And we got a feedback that this time try and do something differently. This message was so important that it has to reach each and every person in the world, not just the pediatricians or the doctors. And at the same time, what we saw is that people are now looking at different kinds of storytelling, which is the most effective way of communication. So we came up with this flip book, as Chief Guest Sir Dr. Jamal Raja said, and this was the idea that we come up with a flip book as a storytelling form, maybe as a graphic storytelling, what it is called, to deliver the message. We have not yet gone ahead to make a video on it, but we'll be sharing it with you. All of you will receive it on your on your phone or your email, and it is going to automatically open here in Zoom. It may have to be read out, but when you receive it, you will be receiving it automatically. So requesting to share it. So the title of the book and the story is Antibiotics, the Weapons That Saved Mankind. Shruti, please go ahead. So here you see that multiple drug-resistant microbes are threatening to take over the world, and the year is 2064, 40 years down the line. Our last line of defense is faltering, and mankind's strongest weapons are failing. So a group of weary soldiers approached an old wise woman for advice. She listens carefully and begins to narrate the history of antibiotics. She says that there was a long time ago when human life was fragile and microbes ruled the world. Human lifespan was short, barely 35 to 40 years. So long ago, great scientists discovered the world of microbes, bacteria, viruses, parasites, and fungi. And the scientists then created antibiotics, the weapons that saved humanity. And it's going to be released on the social media, like those childhood may remember those Phantom comic strips. So it's going to drive more interest. So what are antibiotics? Antibiotics are medications used to treat infections caused by bacteria in humans and animals. They either kill the bacteria or prevent them from growing and multiplying. Antibiotics do not work against viruses. All the messages said by our experts are here. And then you see across the years, over time, people misused and overused this weapon. They used antibiotics even when they didn't need them, like for viral infections and use of unprescribed over-the-counter medicines. Cut to 2064. What are these infections then? Should we continue, please? Shruti ji? So viral infections are illnesses caused by viruses, which are small germs that use your cells to reproduce. And some common viral infections examples can be read. Antibiotics, the lady says, do not kill viruses, yet they were used recklessly even for viral illnesses long ago. And you see people coughing and sneezing. And this misuse led to the rise of a new enemy, resistant microbes or antimicrobial resistance, which occurs when bacteria evolve and become resistant to antibiotics. And you can see this very scary graphic. I'm sure even children who look at this will understand the importance of rational antibiotic use. So this makes infections harder to treat and increases the risk of severe illness and death. And I'm sure they will even tell their parents not to insist on antibiotics from the doctor. And then, as Dr. Jamal Raja, Dr. Basavaraj, and Dr. Upendra mentioned, superbugs are now coming up again. And these are bacteria that have developed resistance to multiple types of antibiotics, making them extremely dangerous and hard to treat. And AMR has led to a new kind of suffering. Infections that were once easily treated now take longer to heal, cost more, and sometimes can't be cured, and there's a risk of death. And you see a hospital ward and people, the doctors struggling to control the infections. So the lady says, these superbugs are now a threat to the entire world. Cut back to 2024 again. How did antibiotic resistance develop? Some soldiers want to ask that lady. And the lady continues, antibiotic resistance develops when bacteria are exposed to antibiotics and some survive. These resistant bacteria multiply and can pass their resistance to other bacteria. When antibiotics are used unnecessarily, like for viral infections, they help create antibiotic-resistant bacteria. So now they want to ask her, and this is the future, what can be done? So in 2064, when somebody asks a wise old person there, what can be done? That wise old person will answer, for this, you go back in time to 2024 and meet pediatricians from the Indian Academy of Pediatrics. And then the soldiers have an option of getting into a time travel machine, and they get in the machine in 2064 and come back to 2024, where the Indian Academy of Pediatrics is having its meeting on IAP की बात community के साथ, where we are leading the charge against antibiotic misuse, and we are helping protect children and families by raising awareness and promoting responsible use of antibiotics. So the soldiers from the future have landed back today, and they see today on the 24th of September 2024, the Indian Academy of Pediatrics is talking about how to fight AMR, use antibiotics only as prescribed by a doctor, complete the full course of antibiotics even if you feel better halfway, never share antibiotics or use leftover prescriptions, don't take antibiotics for viral infections, practice good hygiene to avoid infections, and we must use antibiotics responsibly only when needed and always as directed. And then cut back to again 2064, where the lady says that the war against antibiotic resistance is far from over, but with knowledge and responsibility, we can still win. Use antibiotics judiciously, prevent antimicrobial resistance, and learn more from the Indian Academy of Pediatrics. So, ladies and gentlemen, this is a message which we hope will be able to be circulated to each and every member in our community. We'll be translating it into different languages, and we'll be making a video about it. So thank you so much. And we hope all of you are able to use this. Thank you so much. Now again, it's my duty to invite our dear colleague, Dr. Geeta Patil, who heads the scientific committee, has been doing immense work over the last 1 year to get the Indian Academy of IAP की बात community के साथ across to the whole country. And it's my duty to invite her to speak a few words, as well as to introduce the guest of honor, Dr. Baldev Sir Prajapati. Geeta ma'am, it's over to you.
Thank you, Dr. Samir sir. When we created the scientific content, we did not know that such a wonderful flip book is going to come, which is more impressive than what we have created, the scientific content and the PPT. Definitely Dr. Ashok Rai sir, Dr. Bhaskar Shenoy, Dr. Basavaraj Patil, Dr. Gayatri and GP Kaushal, and we discussed among each other when we were creating this content, and this is the best of the content. And today you can see there are maximum number of participants, viewers are here. That shows that how passionate people are there. And as you told, 2064, when we come back 2024, what we are doing, which is the most right thing, which we have to continue to do, using the antibiotic wisely and precisely. And this emphasizes the importance of antibiotic usage. Sir, I am not able to see Baldev Prajapati sir here. So I don't know whether he was there and now maybe he's
there may be some network issue, madam. Any Rangnath Daru
can
sir
move
will-
on to the next session, sir. When he joins, we can ask him to unveil the poster. One poster has to be unveiled.
Rangnath Daru sir is there. You can
Professor
call him.
Rangnath Daruru sir.
I request Dr. Rangnath Darur sir to unveil the poster. Shruti, I think you can.
Rangnath Daru sir, our ID chairperson.
ID chairperson, he is there. Sir, can you, sir, Shruti, please, can you share the poster? And I request Rangnath Darur sir to unveil it and declare it is unveiled.
Yes, sir is there. Sir is there.
Yes, sir. Yes, sir.
Thank you for inviting me, and I'm trying to open it unveil. I'm trying, but what I should
Yes,
do?
sir.
Yes, sir.
You can declare and speak a few words.
Address something about the antibiotic microbial resistance, how to.
Your thoughts, sir.
Yes, sir. No. The combined fight against the antimicrobial resistance is our job. First, judicious use of antibiotics has been discussed. Right drug, right dose, right duration is the rule. Limited armamentarium is left as antibiotics to fight the bacteria and treat the patient. But here we want to have the local sensitivity pattern. So all the culture reports that are being reported should be taken and audited, and the data should be analyzed, and the differing zones should be intimated that this drug is not working against this certain bacteria. So with that, we may limit ourselves in writing a useless drug to somebody. Plus, the right efforts are being laid down by the IAP, and spreading the difficulties and the losses of microbial resistance and the time duration that has been set is the best thing in which we have to fight all up together to limit the bacterial resistance. Thank you. And I unveil the poster that is now displayed on the screen, please. Thank you.
Thank you. Thank you so much, sir. Over to Samir. Yeah.
Dr. Baldev Prajapati sir joined somewhere just now. Oh, yes, sir. Sir has joined. Let me introduce to him fast so that before his network goes. So all of we know Baldev Prajapati sir as a great teacher of teacher. And we have, many of us are always attend his programs, teaching programs. And we know that he has worked for IAP. He was an EB member as well as he was in IAP Committee on Immunization. He was a chairperson of Infectious Disease Chapter of IAP. He was a president of IAP Gujarat State Branch. He was a West Zone coordinator for quiz. All these things show that his academic credentials, and he has organized many conferences, CMEs, workshops. He's an editor or a member of the editor board in many journals. And he has many scientific paper presentations in state and national and international conferences. He has published 55 articles in national and state journals and chapters in textbooks. His book, I think I remember, is Essential Procedures in Pediatric, which was published in 2003. And he has written 2 educational books in Gujarat. Those are very popular books there. And we know that he has served as Assistant Professor of Pediatric Nephrology in Institute of Kidney Disease and Research, Ahmedabad, and in 𝐔𝐧𝐥𝐸 Medical College, Ahmedabad. He is Associate Professor of Pediatric, 𝐔𝐧𝐥𝐸𝐬𝐺 General Hospital and AMC Medical College, Ahmedabad. And he has done tremendous academic work, and whenever he is a speaker, the number of viewers are more. Sir, over to Dr. Baldev Prajapati, sir, because we unveiled that poster, but we like to listen to you about this antimicrobial resistance, which you go on talking so passionately, sir. Over to Dr. Baldev Prajapati, sir.
Thank you very much, Dr. Geeta Patil. I hope that, am I audible?
Yes, sir.
Sir,
Yes,
can I request you to stop, sir? Maybe request you to park the car for some time?
sir, video you off it and you talk it for some time. Otherwise, the disturbance will be.
Okay.
You may just park, sir. That will be better.
Am I audible now?
Yes, sir.
Yeah. Good afternoon, friends. First, let me express a word of gratitude to the office bearers, our very dynamic president, Dr. Basavaraj, my friend, Dr. Yogesh Parikh, as the honorary secretary of IAP, very dynamic persons, Dr. Dalbai, and even the project, I will say, in charge, Dr. Geeta Patil, many friends, those who have contributed for this module, and many more, I will say, friends and executive board members of Indian Academy of Pediatrics. First, let me say sorry because I'm not sure how much I'm clear in the voice and even the visibility because I'm traveling in the taxi. But I hope that this is a very important topic for what so many friends have worked very hard, and even this is very close to my heart. So let me talk regarding this topic. First, I will say my best congratulations and compliments to all the contributors and office bearers for preparing this type of module for the community. All of us know that every president comes with some different type of the, I will say, action plans, but this type of the action plan is quite different. That working for the community, trying reach to the community is quite different. And that too, particularly the topic like antibiotics, as all of us know, that in the pre-antibiotic era, where the antibiotics were not available at all, the mortality rate was quite high. Later on, we got the antibiotics, as already my friends told, we got it, I will say, tremendously. And later on, even the many lives could be saved. But ultimately, we are again probably going for that era of this, even the pre-antibiotic, because many lives at present are lost due to the resistance to the antibiotic. So very rightly, it has been, I will say, issued and addressed particularly these type of the problem, even for the community. All of us know that we are discussing so much regarding on the topic of this, even the antibiotic resistant for the pediatricians and practitioners, but probably hardly for the community. We know that many times for the antibiotic misuse, various factors are playing the role. That may be misused by the practicing friends, but many a times, even by the parents also, and by the community also. Or sometimes when the practicing friends are misusing due to the pressure from the parents and even the relatives. So I think it's very nice to educate them appropriately. Very appropriately, I will say messages have been conveyed, which I was attending in between, that we should explain that fever, every fever, not necessarily infection. Even yes, but the infection is common, but every infection is not necessarily bacterial. On the contrary, viral infection is very common. And therefore, if the viral infection is there, antibiotics has no role. We'll have to, I will say, create, and even we should see that this loud message reaches to the people. Even if the bacterial infection is confirmed and particularly the medical person has prescribed the antibiotics, we'll have to take sufficient time to counsel them. We'll have to explain them that this particular antibiotic is for this purpose, particularly the duration, even the doses, because we know that many times they stop by their own, or even the dose they change. because this may be some having a more adverse effect or something like that due to the diarrhea or something. So that's the biggest problem. So I think to educate them properly, to explain them properly, and I'm sure that if we do, it works very well. And I'm sure that as a whole, with all the various prongs, I will say, which we can use, that educate our friends, medical people, paramedical people, even to the community, explain them, and I'm sure that in a long way, this will work very well. And probably, if not probably in as a whole, but to some extent, we can curtail the antibiotic misuse, and the problem of the antibiotic resistance can be even minimized, or at least to some extent, we can bring it down. As all of us know, that this problem of antibiotic resistance, initially we were facing the only hospital infection. But now the community-acquired infections are also fairly, I would say, good number, and they are increasing for the antibiotic resistance. So I think it is very appropriate issue, very rightly addressed. And I think if we are able to manage it, that the message should reach to every person, even at the remote place, it will be very, I would say, great work and the great contribution by the Indian Academy of Pediatrics. At the end, again, my best compliments to all the contributors and the office bearers, and my best wishes for this program to be more successful. Thank you very much. Again, thanks a lot for giving this opportunity, and extremely sorry due to this, I will say, my traveling in the taxi and this issue, I could not manage it appropriately. Thank you very much. Thanks a lot.
Thank you so much for your kind words of inspiration, sir. So in spite of a technical challenges, you inspired us. Thank you. Thank you so much. Back to Samir.
Sir, I think we are confident that what message we are giving through IAP Ki Baat community ke saath is going to take it in a mission mode, and it is already, Samir Dalwai sir has told that it is have got a lot of impact. So this is the 13th topic. Thank you very much, sir. Over to Dr. Samir sir.
Thank you so much. So thank you so much, Baldev sir. And sometimes it's nice. कार से बात कर रहे हैं, कोई office से बोल रहा है. It looks nice. Thank you so much. I now request our senior vice president, Dr. Satish Sharma sir from the North Zone, to quickly offer his comments.
Hello, our chief guest, Dr. 𝐔𝐧𝐥𝐤𝐢𝐧𝐠, and hello.
Yes. Hello.
Hello, am I audible? Hello.
Yes, sir. Please go ahead. Can you spotlight
Okay.
Dr. Satish Sharma?
President Dr. G.P. Biswaraja, and all the past presidents, all my vice president, all OB members. I think every chemist in the community is a doctor. All the staff nurses go into their home and they are prescribing. So we have to stress that in spite of our national guideline protocol in antibiotic, 60% of the antibiotic prescription they are misused, they are not required. So first we have to convince ourselves that charity begins at home. If we are convinced that we don't have to prescribe, because our prescription is copied by in the community, by the quacks, by the chemist, everything. So we have to decide that our medical fraternity should convince first ourselves, then we can give message in the community that, and we should stress on the prevention of the infection by hygiene, water sanitation, and vaccination, so that we can avert these infection and won't require the antibiotics. So this message we should go to the community. Thank you very much. Hello.
Thank you, sir. Thank you very much. Thank you very much, sir. We now invite Professor Singaravelu, Vice President, South Zone, for his few words.
Good afternoon to all of you. Thank you, Dr. Samir. The respected chief guest was given a wonderful guest address, and our guest of honor, my good friend Dr. Baldev and ID Chief Dr. Ranganath, and our dynamic President-elect, immediate past President, all my co-EBs, and the team who is doing extensively very well this IAP Ki Baat community ke saath under the leadership of both Zamir ji and also Geeta Patil ma'am. This is a very wonderful initiative because, and I always see this year our presidential action plan, all the modules, somehow other way, it is related to antimicrobial, so that we are able to spread the message through the module to all our pediatricians. But this, through IAP Ki Baat committee ke saath, we should reach to the community where the over-the-counter, mainly I insist that it reach the pharmacists. Who is all treating doctors is most of the remote places, even in cities, towns also. This is was most commonly happening in our places also, which we are trying to curb. Definitely, this initiative is going because everybody has taught very nicely, and the booklet which was released will be definitely even the children will love to read it because they will cultivate from the beginning. Their from kindergarten and the other days, the picture real description is so good. Definitely, through this module, we are bringing a very good initiative. Definitely, in future, it will reach the community in a single voice throughout the country, and it will be making a great impact. And as our president vision and president-elect vision, everybody's vision, we are extremely doing very well in the 13th episode. My best wishes for all the efforts having taken. We are very proud that I'm also in the part of this program. Thank you for giving me this opportunity, Dr. Sameer.
Thank you so much, sir. You're absolutely right. We've made it like a storytelling form, so even younger people would be happy to take this. Thank you so much. I now request our dear friend Dr. Santanu Dev from the East, Vice President from the East Zone, to please give his comments. Santanu bhai.
Thank you, Dr. Sameer, and my regards to presidents are all OBs and EBs of Central IAP, the team of IAP Ki Baat Community Ke Saath, and my regards to the chief guest and guest of honor who have joined us today. A very important topic has been taken up this time, and this time it is with a little bit of difference because, of course, we'll talk about misuse of antibiotics by the community as IAP Ki Baat Community Ke Saath, but this is a topic which also should lead to a lot of soul searching amongst us. What we are doing and how we are prescribing, these should also be in focus. We should not lose that focus. And at the same time, we should have advocacy with the government to see that substandard antibiotics, irrational combinations of antibiotics are not put up in government supply and they lead to worsening of the situation. I would like to be very brief. I know you are already stretched for time, and thank you for bringing this again to the team of IAP Ki Baat Community Ke Saath. Thank you so much.
Thank you, absolutely. And this is the whole thing where each of the vice presidents are being able to take it across all the 5 zones and the nook and corner of the country. And that is the vision of President Sir Dr. Basavaraj and President-elect Sir Dr. Vasant. And that is the aim that we wish to. I would like to now, unfortunately, Dr. Atul from the West Zone, Atul Kulkarni Sir, as well as Dr. Ajay Srivastava from Central Zone have not been able to join. And now I would like to proceed to Professor Dr. Shataraj Sir.
Atul is there.
Atul Kulkarni. I just checked now.
Hi, Sameer, I'm here.
I just checked. I'm so sorry. I didn't see your name in the message. I'm so sorry. It's my duty to invite our Vice President of the West Zone, Dr. Atul Kulkarni Sir, to address the gathering.
Yeah. Thank you, Sameer. Our respected President, Dr. G.V. Basavaraja, President-elect Dr. Khaladkar, and past President Dr. Upendra, all the Vice President, all the OBs, EBs, and all the dignitaries on this virtual platform. Also today's chief guest. Again, this IAP Ki Baat Community Ke Saath coming with a very good topic, that is the preservation of antibiotics. We sometimes in our practice see some group of patients, they themselves they ask, sir, isko antibiotic de do. This view has to be changed, and this question should come that, sir, the antibiotic is really needed for my child. Our team has done a very nice job. They have prepared very good posters under the leadership of Dr. Ashok Rai, and also our team of Sameer, Dr. Geeta Patil, and entire team of IAP Ki Baat Community Ke Saath. So this education in the community is definitely going to be help to reduce the use of antibiotic, what I feel. And besides the pediatricians, last 10 years we have started the rational antibiotic program, and we have seen change in the prescription. But we have there are also some practitioners many practitioners who are non-pediatricians. They are also prescribing a lot of antibiotics. So we have to focus them also. We have to take lectures, or we have to consider them, and we have to communicate with them also in this program. What I think. So best wishes for the program. We are definitely going to percolate this program in the West Zone. Thank you very much.
Thank you so much, Dr. Atul. Thank you so much. Is Dr. Ajay? Has Dr. Ajay joined? Because when I checked, he hadn't joined.
No, Ajay is not there. Please go ahead.
Okay. So now we request Dr. Shataraj sir to offer the vote of thanks for this event. Thank you very much.
Thank you, Dr. Samir. First of all, I want to thank all the participants who are the people who are going to dissipate this matter to the whole nation. And it's my duty to thank Dr. 𝐔𝐧𝐥𝐤𝐢𝐧𝐠, President of Pakistan Academy of Pediatrics and President of SAPA, for attending this program. And I thank you for all your wonderful words, sir. And I thank our guest of honor, Dr. Baldev, sir, who is teacher of teachers and very nicely has put the importance of today's meet. And I thank our dear President, Dr. Basavaraj, sir, for getting a wonderful dream of IAP ke baat and community ke saath, which is very useful for the public. And I thank Dr. Vasan Kalatkar, our President-elect, for supporting him. And I thank Dr. Upendra for his wonderful words, and Dr. Yogesh Parikh, sir, for his nice participation, and Dr. Atanu, who could not join due to some reason. And I also thank all the 5 vice presidents and all the EB members. I thank all the past presidents and Dr. Sitaraman, sir, for having participated in this program. I thank all the national coordinators and scientific committee members. And I thank the expert committee headed by Dr. Ashok Rai, Dr. Ranganath, and Dr. Bhaskar Shanai and team. I thank Dr. Shruti and her team for creating a wonderful comic book on this. And this is a very important program for the children of this country to save themselves. And I request all the parents to take part in this and to study, to go through this and to save their children and to save the country and save the antibiotics. Thank you, and thank you very much.
Okay, may I have
Thank you so much, Syed Jamal Raja, sir. Thank you very much.
May I have last 30 seconds?
Yes, sir. Please, sir.
Thank you very much. I just wanted to thank once again formally Basavaraj ji, who is the current president, Vasant, who is the president-elect, and Upender, who is the ex-president. And there was a request for a share from Samir. So I would like to take this opportunity to end this with a share from Ustad ज़ौक़. कहते हैं कि बीमारे इश्क का हो न तुझसे हो गर इलाज, बीमारे इश्क का हो न तुझसे हो गर इलाज, कह ए तबीब तू ही कि फिर तेरा क्या इलाज. So if the physician has not been able to treat the sick, then how should we treat the physician?
बहुत अच्छे, very good, very well.
बहुत बढ़िया सर, बहुत बढ़िया सर. Thank you very much.
Thank you, sir.
Thank you very much.
Wonderful combination of science and poetry. We request Dr. Basavaraj sir to declare the evening.
Yeah, thank you so much, Samir ji and Jamal.
Samir, congratulations on your new idea.
Thank you so much. Thank you so much. I hope it
You
will
can patent a comic strip now. Bring out one strip regularly.
Thank you, Shruti.
Thank you, sir.
We had a very good attendance, Samir, today. It reached 130.
138, sir. Maximum 138 today.
Till the last, we were above a century.
This is
all credit goes to Syed Jamal Raja, sir. Sir is there. Everybody is joined.
Yes.
Thank you, everybody.
Thank you.
Thank you.
Thank you so much.
We declare it is end.
Thank you.